The first batch of vaccines to combat the Mpox virus outbreak in Africa is scheduled to arrive next week as the deadly skin rash ravages several African countries. Delays in approval and distribution of the much-needed vaccines have left troubled African countries struggling to contain the virus. In a repurposed Ebola treatment center near Goma in eastern Congo, Elizabeth Furaha gently applies ointment to her 7-year-old son, Sagese Hakizimana's rash-covered body. The 30-year-old mother, who fled conflict to live in a displacement camp, now faces a new battle, her child's fight against Mpox. Since we arrived, his eyes have returned to their normal shape, and even the lesions he had are now just scabs. The medicines they are giving him are working. It has taken so long to get vaccines to those in need like Furaha because the global system to get tests, treatments and vaccines to lower income countries for health emergencies is not working. Next week, 10,000 Mpox vaccines are due to arrive in Africa, the first doses outside clinical trials to reach the continent, where the dangerous new strain of a virus that has afflicted people for decades has caused global alarm.
The issue of access is the one that globally we also need to shout about, because it is really outrageous that after COVID we're going back into the same situation, that, you know, the African region once again doesn't have access to vaccines easily.
The World Health Organization only this month asked vaccine manufacturers to submit the information needed for an emergency license for Mpox shots. It urged countries to donate shots until the process was finalized in September.
Until then, we are looking to the government to provide us with a plan, a time frame. And we believe that vaccines still are key to a successful response to cutting off the chain of transmission, but also preventing new transmissions.
Kenya has recorded 2 cases of the virus so far, with health experts warning that there is still no need for alarm. Deborah Chelangat, NTV.